So welcome to another episode with a farmer. So in this video, we wanted to actually talk about diseases in livestock. So I have here with me an expert in pig and an expert in poultry. So they want to share their experience regarding diseases in livestock. So I have here with me Mr. Ogwele. So we want to talk about some of the diseases that affect ruminant animals. So let's talk about disease. I know you are expert in it, so let's talk about diseases in animal.
Yeah, you know, when we are talking about ruminants, we have two types.
Okay.
We have large ruminants,
Okay.
cattle, then we have small ruminants.
Okay.
That's why we talk predominantly about sheep and goats. So there's one particular disease that is very common.
Okay. Before we go that, let's talk about the large ruminants.
Okay.
What are the characteristics of large ruminants?
The thing is how they categorize them. They are usually big, cattle, buffalo.
Okay.
You know, they rear buffalo now as livestock.
Okay. Okay.
So that is the big ruminant or large ruminant aspect.
Okay.
So when we're talking about small ruminants now, predominantly sheep and goats.
Okay.
So
they are just the small.
Yes, small. They refer to them in research as small ruminants.
Okay.
So the one of the most common diseases that affects small ruminants is PPR.
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 Sheep and goats.
Yes.
PPR.
It's the full meaning is in French. Peste de petit ruminant.
Okay.
So it's a disease that affects ruminant animals.
Okay.
So and it is caused by a viral agent.
Okay.
It is caused by a virus. So when your animal is being affected with PPR, you have to see some clinical signs. For example, the animal will have high fever, shortness of breath. You see discharge from the nasal cavity and the buccal cavity. So the animal will be inactive, you know, of course, loss of appetite.
Okay.
So and that disease, since it is viral, it will affect the animals, and it will eventually lead to death
in the animal.
But how can we avoid, or how can we prevent it? There is something they call the PPR vaccine.
Okay.
So once you see slight symptoms, or maybe when you just bought your goats, moving them from the farm you bought them from to your own farm, you have to give them the PPR vaccine.
Okay.
Just as a preventive measure. So once you give them the PPR vaccine, then they are good to go. Then some of these animals, they recover from PPR.
Okay.
They recover. So when they recover from PPR, it makes them strong. It makes them resistant to PPR for at least for the next 5 years. They won't have that disease again, even if it is ravaging nearby farms. So they would have developed resistance immunity
for the
to that disease.
What category is a pig belongs to? Is it a large?
Pig is not a ruminant animal. Pig is a monogastric animal. It's a monogastric animal.
We'll talk about that. Let's talk in our next video. We'll talk about that.
Okay.
So now let's go to Mr. Ayla. So let's talk about livestock, poultry and turkey. Some of the diseases that are common there. Let's talk about it.
Thank you, sir. I want to talk about disease. Disease is simply defined as unwellness. That I mean, the animal will not be well.
Yes.
The absence of wellness.
Okay.
Of animals, either in mammals or animals.
Even in human beings.
Yes, even human being. Absence of wellness. The person will not be able to do what he ought to do.
Yes. Sickness.
Sickness will set in. Now, when we talk about disease, I want to streamline it to 3 categories of disease. As you say, chicken and turkey. The 3 diseases that is common in chicken and turkey is Newcastle, CRD, coccidiosis, and fowl pox.
Okay.
These are the 4 diseases that are very common in turkey, and mostly in turkey.
And okay, let's do it one after the other. Let's talk about turkey now.
Mostly in turkey, Newcastle. The Newcastle affect both turkey and chicken.
Okay.
Coccidiosis affect both turkey and chicken.
And chicken.
CRD affect both turkey and chicken.
Okay.
Majorly, fowl pox majorly affect more of turkey to chicken.
Okay. Okay.
Now, let's talk about the Newcastle. Newcastle, also known as ND, Newcastle disease, NDV, Newcastle disease virus, because the disease is caused by a viral agent. Now, Newcastle in the farm can damage the life of the farmer
Okay.
if the farmer is not careful. Now, what are the signs of Newcastle in birds? The eyes will not be sharp, dullness of the eyes, slow in movement, and their poo will be greenish. And once it's greenish like that, you know that something is happened. The greenish of CLD and Newcastle is a bit different.
Okay.
Now, they will not be sad. Nervousness will set in, loss of appetite, of course.
Lots of appetite.
It will set in because they will not be able to feed well and because of what they are fighting with in their body. Now, how can we take care of Newcastle?
Okay.
We need to observe by using the vaccine. Vaccine. Once the vaccine is being used, then which means you are introducing that disease to them in the first place.
Okay.
You are introducing Newcastle to them in the first place. That once the disease comes in, they will be able to fight it back because they have built up the immunity in their system. Now, and when you are giving the vaccine, you don't use chlorinated water to give them the vaccine. Because if you use chlorine water to give them vaccine, it will ban the effect of that vaccine in their body. Now, let's go to coccidiosis. Coccidiosis affect both chicken and turkey.
Okay. At what age does coccidiosis affect this poultry and chicken and turkey?
Now, due to the cleanliness of the farmer.
Okay.
Now, because in some farm their major disease is coccidiosis.
Okay.
That is why we must be very, very, very careful when we are taking new stock of birds. Now, you will have known the type of disease the farm you purchase the animal from is dealing with from the cartons.
Okay. But at times you don't have that kind of
at times you don't have kind of opportunity. Now, you will have been seeing some in the carton, they will have greenish color, some brownish color, some whitish and the likes. Now, if you are observing pure whitish color of poo, it also connotes coccidiosis. Many people think that only brownish and blood stew connote coccidiosis. Now, when you are noticing that, coccidiosis connotes that the intestine have injury.
Okay. Injury in
the intestine. Now, what are we going to do to stop the coccidiosis? Is by healing the intestine.
Okay.
If you don't want to have any problem with coccidiosis in the first place, then that means you have to give them the vaccine.
Okay, coccidiosis vaccine.
Yeah, which we call Immucos.
Okay.
Immucos is given on the third day.
Okay.
When you have the stock. Now, ultraviolent fowlpox.
Okay.
Fowlpox is immediately transferred through mosquitoes to the animal. Yeah.
So mosquito also
affect chicken and turkey. They transfer it into their body. Now, which simply means or around your pen, there should not be bodies of water,
which can be an
host to the vector. Now, the ultraviolent fowlpox is of two types.
Okay.
We have the one that we call wet pus and dry pus.
Okay.
How do I mean? When we talk about wet pus Wet paws can go to the extent of attacking the turkey or the fowl in their throat.
Okay.
They will not be able to open their mouth very well. Sometimes they will be gasping for breath.
Okay.
Now, if such a thing happened to the birds, that knows that it is wet paws. Now, if of course you know dry paws, it will show on the comb, and before you know, it's getting dry. It will be coming out, getting dry. It will be coming out, getting dry. Now, how can I take care of fowl pox in the farm? Is by giving them the vaccine.
That means for all these diseases, there is a vaccine for it.
There is a vaccine for them. It will reduce the level and the rate at which the fowl pox will attack them.
Okay.
Now, mostly, now these days, we give turkey the vaccine around 3 to 4 weeks.
Okay.
And it can be repeated around 9 weeks.
Okay.
Now, when you give them that vaccine, it builds up their immune system. Even if the fowl pox eventually come, if it just come, and before you know, we advise don't give anything, just give them a little drug. Either you give them pox cure and steril, or pox cure and Vitamix. So that one will take care of the stuff, and it will just clear off. Now, CRD, which is called chronic respiratory disease. This chronic respiratory disease affects birds and turkey. And how did it affect them? It attacked their respiratory organ. They will not be able to breathe very well. And when they're not breathing very well, their activities will be reduced. Jumping here and there will be reduced. And before you know, suddenly that will happen. Die suddenly. I've been thinking, what is happening? But this chicken, this turkey, I left them like this yesterday. What's happening?
They were active.
They were active. But you don't know that something is happening in their body. Now, these guys, you'll be hearing some sound.
Okay.
In the pen. Not knowing that something is happening to them, you think that maybe it's just normal gesture. Now, how can I take care of CRD? CRD, you give them drug.
But there's no vaccine for it.
No vaccine.
Okay.
For now. You give them drugs that will tackle the respiratory, that will clear the respiratory tract, the trachea.
Okay.
So once it take care of that, it clear off the stuff, they become okay, and they will continue growing. For us to know, all these diseases affect the growth of the animal drastically, because they will not be able to eat and convert the feed to flesh.
So, okay, let's go back to Mr. Abdele. So now, one advice will you give to a new farmer and or any farmer, anybody that wants to go into farming concerning ruminant animal, goats and sheep?
Yeah, because hygiene, number one, hygiene is key. Once the surroundings of your pen is clean and neat, it will reduce the way disease comes to your pen. And number two is nutrition.
Okay.
Nutrition is by far the most important. Once they have good nutrition, other things are minimal. It will make the animal agile, it boosts their immune system, and once they make good use of this quality feed you are giving them, then disease will have no way around them.
Okay. So what advice will you give to anybody that wants to go into turkey or poultry?
As my colleague in the field has talked. Now, the key aspect of preventing disease is cleanliness. You have to sanitize the whole environment, sanitize their feeding trough, sanitize their drinker, and other things like that. And even you as the farmer, before you enter into their pen, sanitize yourself. Because of that, by the reason of that, you'll be able to cut off the inflow of disease. And as he has also talked that nutrition is very key. A balanced diet to animal is very key, because when you give them the balanced diet, it gives them a wonderful immune system. You cannot be given a shaft and the disease will come and they will not fall. They will surely fall. But when you balance the diet, that diet that they have, because the weight of the animal will be so heavy, and now when the weight is even before the weight reduce, you will have tackled the disease.
So thank you so much for watching the video. Don't forget to like this video, turn on the notification bell, and don't forget to subscribe to this channel till I come your way in our next video. Thank you and God bless.